how are you doing today? My name's Joel. I'm going to be your student nurse.
Hi.
Can I get you to state your full name and your date of birth?
Yeah, Lily Von Trapp, 4/17/1937.
Excellent. Could I see your wristband?
Mm-hmm.
Make sure that is correct. All right, great. So I will check that with the EMR, and sure enough, we do have the right resident here. Provided for patient privacy, the room is safe, and I have performed hand hygiene. As a little bit of a background on our resident, she is an 88-year-old female here primarily helping out her husband, but also has diagnoses of congestive heart failure, respiratory failure, hypertension, and paroxysmal atrial fibrillation. Upon entering the room, I noticed that she did respond to me. She did hear me. She therefore is breathing. There are no signs of blood loss or cyanosis, so there are no obvious signs of lack of perfusion. All right, Lily. So today we are going to be performing a head-to-toe assessment. I'm going to be asking you some questions, listening to some sounds, and doing some other physical assessments on you. Does that sound okay?
Yeah.
Okay, great. So at this point, I would take her vitals. Her SpO2 is 94% on 2 liters of supplemental oxygen. Her respiration rate is 16 breaths per minute. Temperature is 98.1 degrees Fahrenheit. She has a heart rate of 77 beats per minute, and her blood pressure is 146 over 90. I would wait 2 minutes, have her stand up, take her blood pressure again. It is 120 over 70. This is positive for orthostatic hypotension. While she's standing, I would take her weight and have her take a few steps around the room with her walker to assess her gait. Her weight is steady, but her gait is unstable. All right, Lily, are you experiencing any pain today?
A little bit, yeah.
A little?
Yeah.
Okay. On a 1 to 10 scale, what would you say, what would you rate that as?
A one.
A 1? Okay. Where is that pain?
It's in my right knee.
Your right knee?
Mm.
Okay. And its characteristics, would you describe it as dull, achy, sharp, stabby?
I would describe it as achy.
Achy? All right. And is this new pain or is this something you've experienced for a while?
Oh, it's an old injury. I've had this for quite a while.
Okay. All right. And otherwise, how are you feeling?
Good.
Good. Okay. How's your mood been?
My mood's been good.
Good. Have you noticed any changes recently?
No changes.
No? Okay. What about your stress levels? Do they seem manageable?
I've been a little stressed, but it's been manageable.
It has. Okay. Well, let us know if there's anything that we can do to help you with that. Okay. And Lily, can you tell me where we are right now?
We're at Front Range Long-Term Care Facility.
Okay. And do you know why you are here?
Yeah, I'm helping with my husband, but I also have some conditions of my own.
Okay. And about what time it is?
It's about 10 o'clock in the morning.
Okay. All right. So resident is ANO times 4, and her speech is clear and not slurred. All right. Are you experiencing any headache at the moment?
No.
No. What about nausea, vomiting?
No.
No. Dizziness?
No dizziness. Oh, I guess a little bit when I am standing up, but I try to be really cautious of it.
Okay.
Yeah.
Good. Good. I'm glad you're aware of that. All right. So now I'm going to check out your pupils and your mouth. I'm going to shine this light in your eye if that's okay. All right. Open your mouth. Thank you. All right. And have you give me a big smile. All right. Fantastic. So our resident is Perla. Her mucous membranes are moist, pink, and intact. Smile is symmetrical. All right. So now I'm going to ask you about um, some heart and some lung stuff.
Okay.
Are you experiencing any chest pain right now?
No.
No? Okay. What about shortness of breath?
No.
No. What about when you are active, when you're walking around doing stuff?
Yeah, when I'm out doing stuff, I have to take breaks pretty often. I get shortness of breath.
Okay. All right. Do you have a persistent cough?
I do have a persistent cough.
You do. Okay. Is it dry? Or is it productive?
It's usually productive.
Productive. All right. And when you do cough something up, what's the color and consistency of that?
It's thin and clear.
Okay. All right. And do you have any trouble swallowing?
No.
No. Okay. With thin secretions and no trouble swallowing, resident is at low risk for aspiration. All right, so now I'm going to go ahead and give a listen to your lungs and your heart, if that's okay.
Yeah.
Okay. Um, So I would normally go under the shirt for this to be able to hear better and also to be able to inspect the integument of the torso and the back. But for video's sake, I will just go over the shirt. I've noticed that the chest is symmetrical. There are no obvious abnormalities or protrusions. Work of breathing is not labored, but the expansion is just a little bit shallow. Have you give me a deep breath? Deep breath. Deep breath. Deep breath. All right, now I'm going to listen to your heart underneath your breast. And I would normally do this for 30 seconds just to check for that AFib, but for the sake of the video, we'll shorten it. Thank you. Have you turn towards the wall, and I will listen to some lung sounds on your back. All right, deep breath. One more. All right, deep breath. 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 And one more. All right, thank you. So there are some crackles in the base of the lungs, and on the top of the lungs, they're diminished sounds, but clear. The heart has is regular, and I can clearly hear just the S1 and S2 sounds. The integument of the torso and the back are intact, no signs of bruising, abrasions, or skin breakdown. It is warm, pink, and dry to the touch. All right, so if you don't mind, oh, and one more thing. At this point, I will check for jugular vein distension, which I see none of. All right, at this point, we're going to talk about bowel movements and urination. Is that okay with you?
Yeah.
Okay. All right. So, are you having any incontinence issues? Are you able to make it to the bathroom, bowel, urinary?
I can make it just fine to the bathroom.
Make it to the bathroom?
Yeah.
All right. And do you have any pain with your urination?
No.
No? Okay. Do you feel that you're able to fully empty your bladder?
Yes.
Yes. Okay. And when was the last time that you voided?
Um, the last time I avoided was this morning.
This morning? Okay. Thank you. And what about your last bowel movement?
It was yesterday afternoon.
Okay. What was its consistency?
It was soft, but not too loose.
Okay. And do you have any trouble stooling? Any pain?
No.
No? Okay, great. Now at this point, we are going to listen to some of your bowel sounds. I'm gonna take a look first. You'll lift up your shirt real quick. I see that there is no distension here, that there are no obvious masses. Give a listen. All right, vowel sounds are normal. I would listen for roughly 20 seconds to see that they are hyperactive or hypoactive. The vowel sounds are normal. They're about 10 seconds in between each. Um, the integument of the skin is intact, no bruises, abrasions, lesions. It is warm, pink, and dry to the touch. So I'm also going to press on you, just on your abdomen, just a little bit. Is that okay? Let me palpate here. also going to palpate the liver for signs of hepatomegaly. No signs there. The abdomen is soft. There are no masses. And was there any pain with that?
No.
Okay. And could you also tell me a little bit more about the last time that you ate something?
Yes. Well, I ate breakfast and I had some juice with it this morning.
Okay, fantastic. Um, so yeah, let's go ahead and move on to your extremities. But first, I'm going to give your skin just a little bit of a pinch right here. Check for skin turgor. There is a little bit of tinting, moderate turgor to the skin. All right. So Lily, if I can have you raise your arms up over your head. Excellent. And now I'm going to inspect the skin on the arms. Notice that there is, the skin is intact, warm, pink, and dry. And did you feel that on both sides equally?
Yeah.
Okay. All right, now I'm going to take your radial pulse. Okay, and radial pulse is regular, equal bilaterally, and +2. All right, now let me look at your capillary refill here. Excellent. Capillary refill is equal bilaterally, less than 3 seconds. All right, if I can have you grab my hands, give them a squeeze. Excellent. Push and pull. Super. So range of motion and strength in both arms is equal bilaterally. All right, so now we're going to do the same thing here for your legs. I'm going to inspect the integument on the way down. It is intact. No signs of skin breakdown. Were you able to feel that as I was touching
Yeah.
equal on both sides?
Yeah.
Okay. It is warm, pink, and dry. So now I'm going to look for edema on the ankles. And I am seeing a little bit, but I would consider it trace and non-pitting. Now we're going to check your capillary refill. All right, so capillary refill is equal bilaterally and just under 3 seconds on both sides. So now I'm going to give the pedal pulse a check. Regular, equal bilateral, +1. And now for the anterior tibial pulse. All right, equal bilaterally, regular, and +1 as well. Okay, now just a couple more things. Have you lift up each of your legs? Thank you. And if you will press up. Excellent. And now press down. All right. So range of motion is limited in that right leg due to that right knee. And so is strength. However, sensation is equal on both sides. All right, just a couple more questions now. Were you ever a smoker in your life?
No.
No?
No, I wasn't.
Okay, great. What sort of activities do you enjoy doing around here?
I like to spend time with my husband and we watch Antique Roadshow. I like bingo.
Ah, Antique Roadshow, bingo. I like both of those things. And also, let's see. Oh, what kind of exercise do you get around here each week?
So I walk back and forth from the room to the dining hall a couple times a day.
Okay,
Yeah.
great, fantastic. Any questions for me?
I don't think so.
No? Okay. Anything that that you're concerned with that we didn't address that you'd like to talk about?
No.
No? Okay. Well, great. Well, thank you so much, Lily. You've been wonderful.